Hi, I'm Celina Valenzuela. My patient today is an 8-month-old baby boy brought in by his mom. Mom states my baby's been sick for a week with on and off fever and now has some white patches in his mouth. The history of present illness is the baby's an 8-month-old, well nourished Hispanic male who was brought into the clinic by his mother. She states the baby's been sick for a week with on and off fever reaching 101.0. She adds that the baby is currently being treated with amoxicillin that she received when she took the baby to the ER 5 days ago. The mother states that the antibiotic was prescribed for 10 days and he's on day 5. She feels that the baby's getting better, but he still has on and off fever. She reports that the babysitter gave some Tylenol today because his fever was at 100.5, and she says that she's been able to control the fever with the Tylenol and has been given the amoxicillin as it was prescribed. His past medical history is baby was a full-term baby born by vaginal delivery with no history of chronic illness or any history of recurrent illnesses or ear infections. The patient's an only child of a 23-year-old mother with supportive family and the father is involved. The baby's a bottle-fed baby who is also eating solid baby food 2 to 3 times a day. The mom reports that the baby doesn't have any allergies that she's aware of. He's currently on amoxicillin and he is on the 5th day of a 10-day course. He's up to date on his vaccines. His social history is that he lives with both of his parents who live in the maternal grandmother's home. He does go to daycare, however, it is in a family member's home. It's his aunt that takes care of him while the mother works. His diet consists of formula. He has 6 to 8 ounces a day, 3 to 4 times a day, and 2 ounces of baby food 3 times a day. His family history or that his parents are in good health. They're both in their early 20s. His maternal grandparents and grandparents don't have any significant medical history. They're all in their 40s. The baby is an only child. So on assessment today, the mom reports that she hasn't noticed that the baby's had any weight change. She tells me this by the weight that she was given in the ER when she took the baby 5 days ago. The baby's been pretty stable. She does report that he's been fussy for the last week and he's had intermittent fever. She reports he doesn't have any skin rash. He's had a runny nose with clear discharge. She says he's tugging at his left ear and that she noticed white patches on the inside of his mouth a couple days ago. He doesn't have any excessive tearing or any discharge from his eyes. She said the baby's not lethargic, although he is a little more tired. He is fussy, but not excessively. She said she hasn't noticed that he's wheezing or had any problems breathing. She does report that he's vomited at least once a day. He's got decreased appetite, but he is able to keep down food. She hasn't noticed any constipation or any diarrhea or any food intolerance. I mean, he's able to keep some of his food down. She reports that he has 6 wet diapers a day. So on assessment today, his temperature was 99. He had received his Tylenol approximately 3 hours before his arrival. His heart rate was 100. His respiratory rate was 30, starting at 99%. He's 20 pounds today. He looks like a well-nourished male infant with no acute distress. He is active and awake, alert, appears to be acting like a normal 8-month-old baby. His skin is warm, it's smooth, it's dry. I don't see any rash or redness anywhere. His conjunctiva are pink, they're moist, the sclera is clear, there's no excessive tearing or any discharge coming from his eyes. His ears, his right ear, his tympanic membrane is visible as a pearly gray color. You can see the landmarks. On the left side, however, it is red. It's bulging just a little bit. Um, Mom said that's the ear he is tugging at. Um, and it's hard to see anything, any kind of landmarks beyond the redness. His nose is pink. It's moist. There's rhinorrhea. It's clear. Um, there's no excessive redness or swelling. His throat is pink. His oral mucosa is pink, but there are white patches all along the inside of the oral mucosa. His neck there is non-tender. There doesn't appear to be any palpable lymph nodes. His lungs and are clear. His respirations are even and unlabored. He doesn't seem to be using any accessory muscles to breathe. I don't hear any wheezing. His heart rate is regular and no murmurs noted. And he's got full range of motion of all of his extremities. My assessment is that I'm in agreement that he is having a case of acute otitis media. He's still tugging at that same ear. He's still having intermittent fevers, and his left tympanic membrane is red. The differential diagnosis for that is it's possible that he has otitis media with diffusion or sinusitis. He also appears to have developed a case of oral candidiasis or thrush, which can happen sometimes from taking antibiotics. He has white patches on his oral mucosa. He has a history of infection, and he's taking his antibiotics. The differential diagnosis for that is neonatal herpes or possibly a burn. But upon history and uh, interviewing his mom, it appears that he just has not been on his antibiotics long enough, and he's now developed a case of thrush. So the plan for him is to continue to take his antibiotics as prescribed. He is taking 1 teaspoon of a 400 milligram per teaspoon suspension, and he's to take that twice a day for a total of 800 milligrams a day for 10 days. He's also to take nystatin, and he's going to be taking 100,000 units per meal, and the mom was prescribed 4 to 6 meals. And because he's a baby, he can't swish it around in his mouth, so I taught mom how to paint it onto the patches in the baby's mouth. Now, for pain and for fever, she's to continue to use the Tylenol. The baby can have 10 to 15 milligrams per kilogram, and after doing the math for that, he's to have 3 meals of 160 milligram per teaspoon suspension. The mom was educated that she can encourage fluid intake or keep offering food in small amounts or his formula in small amounts to encourage him to keep that down, and then to use the medication as prescribed. She was also asked to follow up and bring the baby back to the clinic in 5 days to see if there's any improvement. She was also instructed to take the baby to the ER or bring the baby back sooner if the symptoms are getting worse, or if the baby appears to be in any kind of respiratory distress. The mom said she understood. She has an appointment for 5 days from the day he was seen at the clinic. So hopefully when I see this baby again, he will be doing better on his 10-day course of antibiotics. If one thing that I didn't take into consideration and that my preceptor, after I updated her about, was that yes, he needs to take his 10-day course, and the next course of action would be Augmentin, although the mom's insurance doesn't cover it. So for right now, our plan is to continue with the amoxicillin and reassess when he comes back. All right. Thank you. Bye.